The broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone. Welcome to the presentation today. We're really excited you're here, so thank you so much for joining us. My name is Danica Comey. My pronouns are she, her, and I work at Bozeman Health as the Community Engagement Coordinator. My coworker is going to introduce himself. He is on the call as well as a panelist.
Hey everybody, thanks Danica. This is Christopher Coburn. I work with Bozeman Health as the System Manager of Health Improvement and Partnerships, and we're really excited that you're here today with us.
Thanks, Christopher. So we're excited to have you here today. Before we hand the presentation off to our colleagues at PRC, we're going to quick just tell you folks about the Community Health Needs Assessment process. So this needs assessment is a partnership between Bozeman Health, Community Health Partners, and the Gallatin City County Health Department. We conduct the Community Health Needs Assessment every 3 years. This gives us a comprehensive picture of the health and wellness needs of our communities. We then use this data to focus our resources, our efforts, our time, and our energy on improving community health in our local communities. We want to focus on making more equitable outcomes and fostering collaboration. So essentially, we take the data from the Community Health Needs Assessment, and it helps us to inform where our resources are going to go for the next 3 years. So this year, while working on our Community Health Needs Assessment process, we really wanted to make sure that this process was equitable. And so we worked very hard to make sure that we had more people surveyed, that we got more folks to take the needs assessment. So this year we had an online option as well as the call-in option, and we had a Spanish language option that was available for folks online. We then began to look through the data through a health equity and health disparity lens, knowing that not all folks in our communities have equal access to healthcare and healthcare resources. And then we wanted to focus more on varied opportunities for community participation. So we are really excited that you are here today, and we are looking forward to presenting the findings to you all. We want this to be a community-informed decision, so we can't stress enough how much your input matters as we work on prioritizing the needs of the communities that we serve. So Jana will go a little bit more in detail about this, but there's an opportunity for you to provide feedback to us on what you think are the most important needs in our community. That being said, though, all audience members are on mute. If you have a question, please use the chat function. We'll be monitoring that through the conversation. And I'm now going to turn it over to Jana from PRC. So thank you so much for being here.
Thank you, Danica, and thank you all for joining us over your lunch hour today. My name is Jana DeStefano. I'm the Director of Community Health for PRC, and my pronouns are she and her. I'm very excited to be with you all today and again have the opportunity to work alongside your teams and share these important findings. PRC has actually had the privilege to work with Bozeman Health and the Community Health Partners and Healthy Gallatin for about 10 years now, and in specifically the Big Sky area since 2017. PRC also works nationally, so I'll be able to give you a little insight into the national perspective as well. Okay. So just a little bit about how we conducted this study. There was both quantitative and qualitative components. PRC conducted a secondary data review specifically for Madison and Gallatin counties, and we looked at the data sets that are currently available in the public domain. So specifically information from the census, information available in birth and death certificates, and I'll share much of that data with you today. For the qualitative component, we had an online survey we developed targeting key informants. Many of you may have participated in the study, and we thank you again for your time and energy. Those key informants represent individuals who have a vested interest in the health of the population. And for us specifically, they included 25 physicians, public health, other health providers, social service agencies, or community leaders. And they really gave us quite a bit of qualitative input around the various health topics that we touched on. And they were asked to participate mainly because they worked with vulnerable populations. So their responses to that survey are representative of their own experiences and reflective of the population in which they serve. But truly the heart of our CHNA is a customized local health survey. So it was a community survey, a separate survey that was given specifically to residents. So it's different than that online key informant survey. And as I mentioned before, it was kind of a two-pronged approach this year. We did a random sample over the telephone. And then this year we had an internet-based survey that was distributed more broadly. And in doing this, we hope to reach into more populations that may have traditionally been more difficult to get input from. We also have some great benchmarking. We've got our previous survey data from 2017, the PRC National Health Survey, the Montana BRFIS data for some state comparisons, Healthy People 2020 targets, and then national vital statistics data as well. So a little more about that population health survey. The final sample was 137 residents comprising the 3 zip codes in the Big Sky area, which is actually the purple in the little map I have on the right-hand corner of the slide. And that sample size gave us an overall maximum confidence interval of plus or minus 8.3%. And at this time, as Danica mentioned, we tried to be even more inclusive, so we had that survey via the internet and the phone, and it was also offered in both iterations in Spanish. So the survey itself was pretty long, about 125 questions, so we're able to get a lot of information, and although it is quite long, we really do have great participation. People like talking about themselves, so if we can get them to answer the phone, we can usually get a completion. We're asking about specific events, actions, conditions, so truly people, the survey feels quick for them, and it doesn't feel like they're talking to us for about 20 minutes. And then on the bottom of this screen is a chart showing some demographic characteristics. The orange bars is the true population for the Big Sky area. Our survey sample then is the red bars. So essentially when we looked at the comparisons, those orange bars and the adjacent red bars, and they're very similar. So the takeaway is that the survey sample looks very much like the distribution of the population in terms of gender and age, race. And so this representativeness allows us to project the findings to the general population and do so with confidence. So about today's event, I just want to give you a few housekeeping items. All attendees are in listen-only mode. However, you can use the question section of the GoToWebinar dashboard and or the chat function, and I'll address any of the questions at the end of the data presentation. And then we also have some opportunities to get some feedback from you. And in doing so, we're going to use a platform called Mentimeter. And we will have you either grab your mobile device, a tablet, or open a second screen or window. Be careful, though, not to close this window so you exit out of the presentation if you do that. And we'll use this platform to help us prioritize the health issues at the end of the presentation. So I want to start with that type of activity, find out who's in the room with us. So please go grab that mobile device, open that second browser, and go to menti.com. And once you get to menti.com, it's going to ask you to enter a code. And that code today is 1499264. So give everybody a chance now. Again, please go to menti.com and enter the code 1499264. Oh, and it looks like it's pulling up oops, sorry about that. A different question. So just give me one sec. And I'll reload this and hopefully it'll bring up the right question for you guys on your Menti. Okay, so you should have seen a little thing that says go to slide. So what type of organization do you represent? There's some options, and if you scroll on your phone, you'll see a blue submit box at the bottom. See some votes are coming in now. And if you're not representing an organization, the last option is I'm a resident, no organization. And again, don't forget to hit submit. Give everyone a few more minutes, a minute or so to complete this. Again, menti.com, and use the code 1499264. It looks like we've got a physician in the room, some public health, other not-for-profits. Okay, well, go ahead if you are still on that slide. Go ahead and keep voting, keep filling in so we can identify who was part of this conversation today. We really did want to get as much feedback from the community as possible. So anyone, and in doing so, we wanted to kind of gauge who was in the room. And as we go then forward, we want to get additional input, know who was a part of the conversation and who we should keep reaching out to. So as Danica mentioned, there are some additional new survey questions and findings this year. And this slide is actually going to show data for the overall Bozeman region. So it's one of two slides that I have today that are not just big sky. But I want to first share with you some of the new findings this year. Our survey is ever evolving, and as Danica mentioned, there was a very intentional approach to creating the survey instrument this year. And one of the new questions, or the series of new questions that we added, was around adverse childhood experiences, or ACEs. And ACEs specifically are traumas or abuse or neglect that individuals may have experienced as a child that are affecting their health outcomes later in life, impacting their adulthood. So I have on this chart the prevalence for each of the 8 dimensions, each of those 8 ACEs. And so we found that almost 38%, 37.6% of overall regional respondents reported some type of emotional abuse. So before they were 18, these individuals grew up in a home where there was an emotional abuse. 28.8% lived in a household where someone had a substance abuse issue. 24.9% lived in a home with someone with mental illness. 24% were children of parents of divorce or separation. 17.6% reported some type of physical abuse. 14.6% reported intimate partner violence. 13.2% reporting sexual abuse before the age of 18. And 5.1% grew up in a home where a household member was incarcerated. And not only from our research, but national research, they've found that the effects on an individual can be cumulative. And for that reason, we looked at the number of ACEs reported. And for those who experienced 4 or more, we considered them a high ACE score. So for the Bozeman region, 15.9% of regional residents reporting 4 or more of these ACEs. And then the chart on the right shows this in our data. So we absolutely are confirming what they're seeing in other parts of the country. The dark red shows the gap in the individuals that have high ACE scores compared to those with low ACE scores or no ACEs. And the data is quite different here for current substance abuse, those struggling with paying rent or mortgage, those I'd say they have depression, reporting access difficulties, domestic violence, mental health treatment, activity limitations, and food insecurity. For all of those, there's a significant difference or significant worse than for those individuals with high ACE scores compared to those with low or no ACE scores. So again, that intentional and focused approach on the health equity led us to looking at all of our survey results by different populations. And on this screen here, I've kind of highlighted some of those outcomes or the disparities for older adults, the LGBTQ community, and communities of color. So again, this is a regional approach, but looking at our older adults, we found that they were more likely to have poor health status and more likely to have health risks such as physical inactivity. For the LGBTQ population, disparities that existed around poor health status, mental health and substance abuse, health risks specifically for them for overweight status, and then they were also more likely to report access difficulties. For our communities of color, they were more likely to have increased ACEs or a higher ACE score. Their health risks were specifically around nutrition, and then they also reported more likely to have access difficulties. So there's so much more information to be had, but I really just wanted to kind of give a highlight and touch on this. There's truly something for everyone in the CHNA. The report itself is around 180 pages. So if you don't see something today that you're like, oh, I wonder if they talked about it. We might have, and absolutely, the Bozeman Health and their partners will be distributing it broadly. So we encourage you to go and delve into the full CHNA. But as I mentioned before, our key informant input, we asked those 25 key informants to give us some input around 17 health issues. And again, those key informants were physicians, public health, social service agencies, and community leaders. And in that key informant survey, we presented them with 17 health issues and asked them to rate each health issue as either a major problem, a moderate problem, a minor problem, or no problem at all. And you can see the results for the top 5 here. Mental health, 56% of the key informants rated it as a major problem. 32% saying it was a moderate problem. Substance abuse, 48% of them said it was a major problem. 44% saying it was a moderate problem. And then there's a pretty steep drop off here for access to healthcare services, tobacco use, and nutrition, physical activity, and weight. All 3 of those were rated as major problems by about 16% of the key informants. And then they were kind of tied for our top 5. In the full report, though, we have extensive quotes around why the key informants felt that these issues were major problems. So you can absolutely delve into more details there. So this is really just a roadmap of where I want to go today. I'll have 1 to 3 slides for each health issue, and I'm showing these alphabetically, but at the end of the presentation, I'm going to ask for your feedback to help us prioritize. And today I'm really going to focus on the challenges, but there's so many positives and things that we can lean on as we seek to create change in the community. So general health status is where I want to start with. The very first question in the PRC survey asked respondents, would you say that in general your health is excellent, very good, good, fair, or poor? And that question is fairly perception-based, but really it's very predictive to other health issues and actually activity limitations as well. And on the chart, you can see that about 3/4 of the respondents, 76.1%, said their health was either excellent or very good. Another 14.3% said good. And then 9.6%, nearly 1 in 10 though, are saying that their health is fair or poor. So we can look at all of our survey indicators in a variety of ways. Certainly one is by geography, and that's what I have on the screen here. The red bar is the Big Sky area. The green bar is the state of Montana. And the US, or that findings from the PRC National Health Survey, is the blue bar. And you can see here that Montana, actually we fare favorably compared to the state, and we're similar to the US. And we can also look at this indicator over time. So when we asked this question in 2017, 7.4% of respondents rated their overall health as fair or poor. So it's actually remained stable, even though it's increased slightly. We test all of our indicators for statistical significance, and that will be outlined or highlighted if there was any statistical significance noted. And as I mentioned, there are a variety of ways that we break out the data, including by disparity, so by demographics. And on the chart here, I have shown the breakout for gender and age. And you can certainly see that here there's a correlation with age. Not surprising. As we get older, our health tends to decline. You can see that 13.7% of respondents over the age of 55 reported fair or poor health. And then again, that red column is the overall Big Sky area. Now I want to move on to specific health indicators, and I'm going to start with access to healthcare services. Certainly not a small issue. What I want to talk about first is the uninsured population. And this population represents those without any type of insurance, either through private or public programs, meaning the Medicaid or VA or another type of government. And for this chart, in this chart alone, we're looking at just residents age 18 to 64. So I've excluded that 65 plus population because we know many of those individuals are eligible for coverage through Medicare. And for the Big Sky area, nearly 1 in 5, 18.1% of adults report that they don't have any type of healthcare insurance coverage. Much higher than what we see in the nation and similar to the state of Montana. And when we look over time on the right side of the screen, we're remaining pretty stable. But clearly, we're nowhere near that Healthy People 2020 goal of universal coverage. When we broke it down by demographics, we saw higher rates of uninsured among men and younger adults. The survey also asked a series of questions to determine if individuals had any difficulties accessing healthcare services. And this chart is illustrating the prevalence of each tested barrier for the Big Sky area. And I've listed these in order of prevalence. So going from left to right, you can see that, again, 1 in 5 of those respondents said that they had trouble getting a PCP appointment. 15.6% reported inconvenient office hours impacting their ability to access primary care. 6% reporting that cost of a PCP visit was a barrier, and this was significantly higher than what we found in 2017. 5.8% said just finding a PCP was a challenge. 4.7% said cost of prescriptions specifically inhibited their ability to access care. 3.5% saying transportation was a challenge, and this is actually better, significantly lower than we found in 2017. And then 0.6% saying language or culture was impacting their ability to access care. In addition, this survey asked a series of questions to get at a respondent's health literacy, and we found that 8.2% of adults find it somewhat or very difficult to understand the information that health professionals tell them. When we combined and analyzed if anyone had reported one or more of those delays, we found that overall 37.2% of respondents reporting one or more barriers accessing primary medical care. This is similar to what we see at the nation. However, by demographics, we see that women and younger adults, more likely to report primary care issues in the Big Sky area. The net result of this is what we can see here is that when the utilization of primary medical care or visiting a physician for a routine checkup in the past year. And only 52.4% of those Big Sky residents reporting this type of visit in the past year. Much lower than what we see at the state and the nation, and lower than 2017, but not statistically significantly lower. Moving on to our next area of opportunity, cancer. When we looked at secondary data measures, we find that cancer is the #2 leading cause of death in Gallatin and Madison counties. And on the little sticky note on the slide, these are findings from our population-based survey. We found that 6.6% of surveyed Big Sky area adults have had a diagnosis of skin cancer, and another 2.5% have been diagnosed with another type of cancer, which is a decrease from 2017 findings, so positive there. Looking now at mortality. So clearly we can look at not only the percentage of deaths those represent, but also death rates, the number of deaths for the population size. And in this case, the death rates are actually age adjusted. So they take into account the age of our population. So when we compare to other localities, the state or the nation, there isn't a difference that's strictly based on age. And when we do that for cancer, we actually compare fairly well to the state and the nation. And much like the state and the nation, our cancer mortality rate is declining. However, specifically when we looked at individual cancer types, our prostate cancer death rate is higher than what we see at both the state and the nation. So an opportunity for improvement there. It's also obviously important to consider cancer screenings or prevention activities, which if done regularly can lower cancer mortality. The PRC survey examined prevention behaviors for several cancer sites, and on the screen now I've got data for 3 of them, specifically mammograms or breast cancer screening for women aged 50 to 74, pap smears or cervical cancer screening for women aged 20 to 65, or colorectal cancer screening for all adults aged 50 to 75. And a positive note here is that our cervical cancer screenings are up from those 2017 findings, now at 73.9%. Heart disease and stroke is our next area of opportunity. Heart disease is the #1 leading cause of death, contributing to about 1/4 of all deaths in the Gallatin and Madison County area. And stroke is the number 5 cause of death, taking in about 4% of all deaths. So combined, nearly 30% of all deaths can be attributed to cardiovascular disease. And again, some related findings from our population-based survey. Nearly 3 in 4, 74.1% of area adults exhibited at least one cardiovascular risk factor. These include weight status of being overweight or obese, lack of exercise, smoking, being diagnosed with high blood pressure or high blood cholesterol. Again, when we looked at that age-adjusted mortality trends, we're comparing pretty well for both heart disease, the chart on the left, and stroke, the chart on the right. And in addition, our survey found that about 5% of adults have been diagnosed with heart disease, and less than 2%, 1.8% of surveyed adults have had a stroke. Moving now to injury and violence. Looking at unintentional injuries, we see the unintentional injury death rate here much better than the state and the nation and trending downward. So kind of going opposite the way that the country is going. Now I'm going to share 3 different types of unintentional injury or accidents, including motor vehicle, poisoning, noxious substances, which includes drug overdoses, and falls, and then other, which is actually less than 3% of any one cause makes up our other category. So motor vehicle accidents is a leading contributor relative to that. We found, or we had a question in our survey that specifically asked about distracted driving. And we found that over half, 53.3% of Big Sky area adults acknowledged texting and driving while the vehicle was in motion in the past month. And this is up significantly since 2017. When we looked at falls among Big Sky area adults aged 45 and older, 41.2% have experienced a fall in the past year, which is significantly higher than what we found nationally at 27.5%. And in that other bucket for, again, Gallatin and Madison counties, that firearm-related mortality, a secondary data statistic, intentional or unintentional, that firearm-related, is below the state, but well above the national rate. Moving on now to mental health. I did want to remind you and kind of preface all of these mental health findings that this was the number 1 health issue identified by those key informants. So just keep that in the back of your mind as we review these findings. When we ask people to evaluate their own mental health, first is a question very similar to the very first question in the survey. So the survey asked people to think about and evaluate their own mental health in terms of depression, anxiety, or problems with emotion. And while most said it was excellent or very good or even good, 12.8% of Big Sky area respondents or adults reporting fair or poor mental health, similar to what we see in the US and also to those 2017 findings. This chart is now showing the number of, the prevalence of residents reporting being diagnosed with a depressive disorder. And depressive disorders include depression, major depression, dyspnea, or minor depression. And 1 in 5 adults in the Big Sky area reporting that they have been diagnosed with a depressive disorder. Similar, almost equal to what we see at the state and the nation. But again, by demographics, we see some disparities. Women, much more likely, 5 times more likely than men to report being diagnosed with a depressive disorder. And the survey also asked respondents if there was a time in their life, 2 or more years in their life, when they felt depressed or sad on most days, even if they felt okay sometimes. 31.5%, nearly 1 in 3 of the adults reporting that they had symptoms of chronic depression. Many of you are probably also aware that Montana has historically a high suicide rate, especially compared to the country. For the 2-county Big Sky area, this is no exception, although the rate is slightly lower than the state. It is increasing over time and significantly higher than what we see in the country. And as I noted previously, the firearm-related death in Gallatin and Madison counties is significantly above that found nationally. And when asked, 31.1% of surveyed Big Sky area households have an unlocked firearm. We also looked at data that looks at the number of mental health providers available to the community. And again, our community here is Gallatin and Madison counties. This indicator reports the rate of the county population relative to the number of mental health providers, including psychiatrists, psychologists, clinical social workers, and counselors that specifically specialize in mental health care, expressed as a rate per 100,000. And by this measure, we found just over 350 mental health providers, and that is 2 counties. Much lower, though, in Madison County. Pretty close to what we see statewide and above that national level. However, we do recognize that this indicator does have some limitations. It only looks at active practitioners relative to the population size. It doesn't necessarily take into account part-time versus full-time. And it also isn't able to take into account that these providers are likely also meeting the demand of the surrounding counties. And we did have a few additional questions in the population survey that I've added here as a text box. 35.5% of Big Sky area adults reporting they've ever sought help for mental health, and 14.9% are currently receiving treatment. Those findings are similar to what we see across the nation. However, 5.7% of these same adults are reporting a time in the past year when they needed mental health services but could not get them. Moving now to nutrition, physical activity, and weight. In the population survey, we had a series of questions that asked about the foods respondents ate, specifically on the day prior to the survey. So we tie it to a specific time frame. And then comparing and combining those responses, we're able to determine if people are getting the recommended 5 or more servings of fruits and vegetables each day. And we found that only 35.3% of respondents consumed the recommended amount. However, this is similar to the US, and it's actually an improvement from 2017 findings. And we also had a series of questions about the types of physical activity so we can understand intensity. We asked about duration and frequency, and from there we can determine if people are meeting physical activity guidelines set forth by the CDC. And although only 35.8% of residents clearly far from a majority are meeting those physical activity recommendations, we compare very favorably compared to the state and the nation. And the survey also asked respondents if they had children, and those that did, we asked about a randomly selected child, so a child with the most recent birthday, and we asked them about their physical activity. And for those with school-aged kids, so 5 to 17, 56.3% of school-aged children we found were getting the recommended level of physical activity, which is an hour or more each day. And this indicator is improving and also well above national findings. So some positive, promising news there. Certainly one of the health outcomes from nutrition and physical activity is weight status. And we asked respondents specifically to give us their height and weight. And from that, we calculated their body mass index, or BMI. And their BMI then places that person in a category of being underweight, healthy weight, overweight, or obese. And this chart shows a troubling reality regarding weight status. Over half, 57.2% of the Big Sky area adults, based on their height and weights, are considered to be overweight, similar to the state and the nation, and similar to findings from 2017. And again, overweight is anyone with a BMI above 25 or higher. When we looked at those respondents who would be considered obese, this is a subset of that former chart, so not in addition to, but it's anyone with a BMI greater than 30. We see about 1 in 4 of respondents are considered obese. So similar to the US, but again, when we look at individual disparities by demographics, women, this time over 3 times higher than their male counterparts to be considered obese based on their height and weight. Oral health is the next area of opportunity I want to go over today. Certainly also important to consider when looking at access to care is access to oral health care or visiting a dental or dentist in the past year, a dental clinic. You can see the red column here is 64.4% of respondents reported visiting a dentist in the past year, similar to that state and national findings, and similar compared to 2017. However, when we asked if they had dental insurance coverage, which clearly could contribute to people's willingness or ability to access dental care, obviously cost is a major barrier for many people, we see a relatively low dental insurance coverage at just 54.4%. versus 68.7% across the US. My last area of opportunity is substance abuse. And again, I want to preface the data with what we learned from those key informants. That group ranked substance abuse number 2 as the second biggest concern for them, with nearly 50% rating it as a major problem, second only to mental health. So the survey did ask about alcohol intake. For example, how many days you drank, how many drinks you had. And from there, we're able to identify excessive drinking. And note, excessive drinking reflects the number of persons age 18 and over who drank more than 2 drinks per day on average for men, more than 1 drink per day on average for women. Or it's anyone who drank 5 or more drinks during a single occasion for men, or 4 or more drinks during a single occasion for women during the past 30 days. So using these calculations, 33.9% of Big Sky area adults were found to be excessive drinkers, much higher than what we see in the state, but similar to the US, and no significant change from 2017. However, another area that we saw an increase was the number of adults acknowledging drinking and driving in the past month, up from 4% in 2017 to 11%. And this is respondents admitting to drinking and driving in the past month. And this is clearly an area where we'd expect to be slightly underreported. We also asked individuals about illicit drug use or illegal drugs. So that's either illegal drugs or prescription drugs not prescribed to them. This is, again, another indicator where we'd expect to be underreported. But 8.6% of Big Sky area adults reporting illicit drug use in the past month, 4 times higher than what we see in the nation, clearly significantly worse, but similar to those 2017 findings. This is one of my favorite questions actually in our survey. We ask respondents if their life has been negatively impacted by substance abuse, either themselves or someone else's, and perhaps in a more telling measure of the true impact of substance abuse in the community. And in that regard, we found that nearly half, 48.5% of Big Sky area adults reporting their life had been impacted negatively by substance abuse, much higher than what we see in the nation. And again, impacting women, are more likely to impact women and younger adults, those age 18 to 54. Okay, so I'm going to open it now. If you have any questions, please put them in the question box, or if you want to comment on any feedback or surprises, anything in the data that stood out to you, please go ahead and enter it in the chat box or the question box, and we'll get to that. Okay, well, if you come up with a question or want to give us any feedback, absolutely enter it in, as we are going to keep on moving along, because I want to make sure and get your input for the prioritization process. So if you could bring back those mobile devices or go to that menti.com again, we're going to complete a prioritization exercise. So for each of the health issues, I'm going to ask you to assign 2 scores. The first score is scope and severity, essentially how big is the problem, how many people are affected, how do we compare to the state or the national data, to what degree does this health issue lead to death or disability, impair quality of life, or impact other health issues, and then ability to impact. Can we make a difference? So what's the likelihood of having a positive impact on this health issue? And this should reflect collaborative efforts between healthcare and other organizations in the community. So those 2 scores again, the first score, 1 to 10 for scope and severity, 1, not a big problem at all, to 10, huge problem. And then ability to impact is the second score, 1, no ability to impact, to 10, we have a great ability to make a change and have an impact. So you'll use a slider to assign a value for each health issue, for each criteria. And again, we've got the scales noted for each, and then you'll be sure and hit submit at the bottom of the screen. So if you want to, again, go to menti.com and enter the code 1499264. And when you finish voting, be sure and hit submit at the bottom of the screen. So don't forget to hit submit. As you complete this, and we did have a question come through, where is Alzheimer's showing up in the study? So we do have Alzheimer's data in the study, and we do have several indicators around Alzheimer's. It did not show up either favorably or unfavorably compared to the state or the nation for the mortality rate specifically. And we'd be happy to connect with you after the presentation and chat more about that specifically. Okay. Looks like somebody has submitted some scores here. So please go to menti.com and enter that code 1499264. And when you finish voting, please hit submit at the bottom of the screen. And please be sure and submit, again, those 2 scores.
Hey, Jana.
Mm-hmm.
This is Christopher. I just wanted to maybe speak to that question a little bit too about Alzheimer's. I don't know. I think it's a really important question, and it's one that we've been talking about a lot in terms of trying to figure out the way that we could better understand the full impact and of Alzheimer's on our community. I think just to kind of give some more context, what you shared is that if we're looking at just the mortality data, it actually in Montana and in our counties compared to the rest of the country, we're actually quote unquote not as bad as the rest of the country in terms of the mortality rate, but we do really understand that there are issues with how people are diagnosed, when they're diagnosed, what happens when someone is diagnosed, and those things are just hard to get at with the survey questions that we have, and we've been trying to work actively to kind of think through that. So just wanted to share that and name that. It's something that is on our mind that we talk about when we're deciding what questions to ask. We just don't have a good way to really assess for that in this type of survey right now.
Thanks, Christopher. And absolutely, it's absolutely something that we can continue to evaluate. And as we look to future surveys and future CHNAs, try and best determine how to get at that information. It's hard. We haven't, for other communities, asked if you've experienced memory loss in the past month or had a time where we were confused. And so it can be a little more challenging to get at that in this kind of population-based survey. But as Christopher mentioned, they're absolutely being intentional and trying to be sure and look into every different aspect of how we could get at that information. So it looks like some more votes are coming in. So please, again, go to menti.com, 1499264 is the code, and be sure and hit submit at the bottom of the screen or your votes will not count. Give us another couple minutes. Again, we thank you guys so much for your time this afternoon. This sort of feedback is invaluable to the team. And we do have just one more quick audience activity after this, and then as you're leaving the webinar, you will get a quick survey, and we hope that you take just a moment to fill that out. And again, we're just wanting to make sure that we're being as inclusive as possible as at the attendees and offering these opportunities to participate at the right time and in the right method. Obviously, with coronavirus, it's a little different than typical years where we'd be in person engaging with everyone. But we thank you so much for your time. I'm going to go ahead and show the results right now. And if you're voting, please continue to do so. It'll update as we go along, but it looks like mental health. See some results here. Substance abuse. Excuse me. Access to healthcare services also clearly up in this little quadrant. Nutrition, physical activity, and weight. Heart disease and stroke. Injury and violence. Oral health. And cancer. So please, if you haven't had the opportunity to hit submit, please go ahead and do that now. And then just give it one more minute, make sure that nobody's still voting. Okay. So this is our last opportunity to get some feedback from you guys, but we wanted to end kind of on a positive. And we'd like you to enter up to 3 words that best describe the community in your mind. Again, that's the same Menti site at menti.com, 1499264. If you can enter up to 3 words, and then again, make sure to hit that submit button. Okay, awesome. Growing, beautiful, costly. I'm based out of Omaha, Nebraska, so I haven't had the pleasure of going, but my coworker has, and he agrees with the beautiful comment. Active, changing, unique, outdoorsy, supportive, healthy. Excellent. Expensive. Active, underserved, healthy. Loving these words. Okay, well, I'm going to turn it back over to Danica as these responses continue to come in, and I will let her close it out for us.
Excellent. Thanks so much, Jenna. And thank you everybody for not only being here, but for participating today. This feedback is very valuable for us. So we're very grateful for coming today and providing that feedback. So at this point, I think we were able to answer all the questions that came up in the chat box. Is that right, Jenna? Do we have any other questions?
Not right now, but if you do have questions, the email is on the screen now for future comments or questions.
Great, thank you. Yeah, so we'll answer any questions as they come up, but right now we'll keep moving forward. So now that we have all this data, we're in the process right now of sharing out to the community the prioritization sessions, which is what you attended today. So then we'll take the data, we'll put this into a report, and then we'll have the report finalized and ready to the public in early December. That will be posted on Bozeman Health's website for the public to view. After this is finalized, we'll start to build out strategies to address the needs that have been identified within our communities. That process will also be collaborative, and we'd like to reach out to many of you to help us during this process. So other than that, if you have any questions, or if you're thinking and something else comes up and you want us to follow up, or you have something that you think of that's new, that's great. Please email us at communitybenefit@bozemanhealth.org. We monitor that email frequently, and we'll be able to respond to your questions. And then after this presentation, as Jana briefly mentioned, there will be a quick demographic survey. We'd really appreciate it if you could take a few seconds to complete the anonymous survey. It helps us make sure that we are doing the work to reach a diverse cross-section of our community and making sure that we're reaching out to the folks who are in our community. And that's part of the process that we do to make this more equitable. So other than that, thank you so much for joining today. We'll stay on the line for a couple extra minutes to see if there's any questions that come up. But again, thank you so much for being on the call today, and enjoy your afternoon.